Most of the time, siloed medical information is more of a nuisance than anything else. But when Hurricane Harvey hit the Houston area last week, evacuations and rescue efforts forced patients to seek treatment anywhere they could. And most of the time, their health records didn't go with them. That information void can be almost as catastrophic as the catastrophe itself. That's because most EMRs stay behind walls only certain people can access. Your primary care doc might have the key to your most recent checkup and labs, while a cardiologist across town has your latest EKG and a pharmacist your list of current medications. If you checked into an emergency room outside your normal provider network, your attending physician would need your consent to get in touch with each doctor before getting things faxed. Yes, faxed over. In the decade since Katrina, federal health officials have thought long and hard about how to take those walls down in the event of a national emergency. And earlier this summer, they actually finished the first big test of such a technology. Called Pulse, for Patient Unified Lookup System for Emergencies, it would allow disaster workers to find and view patient documents, prescriptions, recent test results for anyone that walked into an emergency room, pop-up field hospital, or evacuation shelter. That would be a really useful thing for Texas to have right now. Over the last week, as Harvey dumped 9 trillion gallons of water across the southeastern corner of Texas, the physical infrastructure of the state's healthcare system has weathered the storm pretty well. Thanks to post-Katrina fortifications like submarine doors, floodgates, and above-ground backup generators, only about 20 of the 110 hospitals in the hardest-hit counties in and around Houston evacuated some portion of their patients, about 1,500 people. Dan Jensen, who oversees 11 primary care clinics serving 160,000 people in the VillageMD Houston network, said on Thursday that there has been a much higher volume of patients than usual at the 9 clinics VillageMD has up and running, 2 closed due to flooding. For lots of these patients, these are not their normal clinics, he said. We can try to pull data on some of them, but it's very limited what we can get. A lot of times we have to start from scratch. Starting from scratch is pretty much the last thing you want your first responder doing, especially in the immediate aftermath of a disaster. But you also don't want it to be easy for just anyone to see your medical records whenever they choose. So how do you solve for both data security and ease of access? Make it a function of timing. How climate change fueled Hurricane Harvey. Climate change didn't spawn Harvey, or any other hurricane, but it has made them more dangerous. With Harvey, imperfect engineering meets a perfect storm. Harvey shows progress on emergency communications since Katrina. As Hurricane Harvey wreaks havoc on southeast Texas, crucial cellular networks remain largely stable, reflecting progress since Katrina. That's the idea behind Pulse. Started in 2014 with nearly $3 million in grants from the U.S. Department of Health and Human Services, Pulse builds a data-sharing network that can be switched on during a crisis. Imagine a world where every healthcare provider in the country is connected to Pulse, either directly or through existing channels, for secure health information exchange. Those connections wouldn't be live all the time. An emergency would activate only the relevant nodes, say, the Gulf Coast during a hurricane event or Northern Rockies during wildfire season.